Core Measure 14, Electronic Exchange of Clinical Information. The objective of Core Measure 14 is to ensure that providers have within their EHR technology the capability of exchanging key clinical information, such as a patient's problems, medications, allergies, etc., amongst other providers of care and or patient authorized entities, and to do so electronically. The measure requires that each eligible provider perform at least one test of this feature during the reporting period. Now, with regards to the requirements for attestation, it is, as the measure requirement stated, simply a test. So when the provider goes in to attest yes on Core Measure 14, he or she is confirming that a test has been performed at least once during the reporting period. Now, of course, instead of a test, there could be an actual need or request for such an exchange, which would be fine. But the functionality has to be used, is basically the core of this measure. Now, note here, a new test must be done at least once per each eligible year of participation. So this is not something that you do once when you turn EMR on, and then you're free for the rest of meaningful use, which of course is going on for a duration of 5 years for Medicare and 10 years for Medicaid. It is something that you will have to redo and reattest every year. Now, this test, which could be an export or an import, may be based upon a fictional patient or an actual patient. That is your choice, as long as the data is in the structured format, meaning it has to be a non-human readable electronic format. Back in Measure 12, which is covered in a separate video, we talked about key clinical information in a human readable format. This is dealing with an electronic format. And the data must be interpretable by another distinct EHR technology or comparable system. In this case, we're talking about an XML file. XML is extended markup language, which is simply a computer format that one system can generate and be read by another. Therefore, the exchanging or the sharing of this data between distinct systems. With regards to an exclusion, there is no provision within Core Measure 14 to exclude. It is a mandatory measure. So we're going to toggle into Prognosis now and see how you can perform this functionality. On our Patient tab, we're going to go into our Review option. The Review option, you may remember, is a patient's historical access to their chart. Now, this is a measure that is looking at when you create the test. So it's irrelevant as to when the patient's date of service is. Whether you've seen the patient during the reporting period is also not a factor, as long as you perform this export/import function before the end of your period. It doesn't matter when the patient was actually treated or how many visits that patient has had, as long as the data consists of the applicable information that was outlined there in the measure, such as their problem list, their medications, and so on. So we've opened up a chart here for Emily Anderson, and on our left-hand side, we're going to go to the menu option, Patient XML. Now, remember that each eligible doctor within your practice must perform his or her own test, even though you're using the same database, and it's therefore the exact same program, just a different patient. Each physician is required by compliance definition to do his or her own test. And it can even be the same patient. You just have to do it for each doctor. So here in the From box, I'm going to choose my binocular and select my doctor. And I'm going to choose Dr. Cooper. But notice here I also have Dr. Internist Butler and I have Dr. Rajesh Koothrappali. So each physician does have to do his own test. You're going to address who you're sending it to, whether it's another doctor, the patient, or perhaps the patient's agency, anybody for whom they have signed an authorization to release medical records, the attorney, the insurance company, or so on. So we're going to go ahead and indicate here that we are sending it to Bernadette Holowitz at ABC Attorneys at Law. We're going to say that our patient signed the release because of the accident she's in. Now, this information isn't necessarily essential. It's recommended because, of course, it will be encrypted into the file, so as a point of reference, you'll always know. But you could actually create the export file without populating this data. And then who is sending it is going to be, in this case, On the Bay. And I'm just going to put, for my purpose, meaningful use, core measure 14 test. And then I'm going to click export. So it's that simple. You've chosen the patient, you've identified the doctor, and now you're doing the export. Now the confirmation says CCD export successfully completed for Emily Anderson. So it gives you the patient's name. CCD stands for clinical care document. Now, the system is set up to automatically require you now to assign a password if you so desire. This is because it is dealing with patient health information. Per HIPAA requirements, you do need to protect it before you share it. Even though it's electronic as opposed to human readable, it still needs to be protected. So you're going to assign a password, and that password can be whatever you would like it to be. You can come up with a local protocol where it is the patient's name, the doctor's name, the patient's date of birth, their date of service, or you can put my color is blue. It's really irrelevant as long as the recipient is told what that password is separately from the file so that they're able to extract the data and use it within their electronic health record system. So now that I've encrypted it, the system is prompting me to save it. And so at this point, of course, I could save it to a directory within my documents. I could save it to a USB port. Perhaps the referring doctor has come into my office and he has given me a USB port. So I could save it directly to that port. That, again, is based on local processes. So I'm just going to save it here under my documents. And notice that it is getting saved as the patient's name and the date that you are actually creating the export. And that way our system is able to read and give you credit for on your meaningful use report. So now that the file has exported, in order to show a record of it in the system, and if you ever got audited, this is where you would take your auditor to show them that yes, you did indeed perform the test. On the same patient review, we're going to go to the bottom option for clinical care document, or CCD/CCR. And there it is. And you notice I had already done it once today, which is why I just had that prompt that it already existed, and I just said yes to overwrite. Normally, it's going to be name and date sensitive, so you would not see that error. But this type E indicates that I have exported it, so that is your record. Now, let's say you also want to do an import. Now, again, the requirement for attestation does not require you to do both, but if you would like to also do an import, notice now our option is actually called XML. So the clinical care document that we're going to import now must be in an XML format. Ideally, it will have come from another system, of course. Maybe a patient has been referred to you. Maybe they're coming to you for post-op care, and the hospital has sent you a CD-ROM or a USB port with their clinical care record, and now you need to import it to Prognosis. So you would go here to the CCD CCR and click your paperclip. Now in our example, we're going to open up our My Documents directory. You would have navigated, of course, to wherever your file is. And in this case, I'm going to go ahead and use William Hopeful, who's a test patient I've already set up. And when I open his folder, here is his XML file. So just pretend I'm on Emily Anderson. And I'm going to attach it. Now that it tells me my file is attached and saved and my screen refreshes, notice now I have an I. The I for import, E for export. And it's that simple. So then if I needed to view the data that I just imported, I can just double click the I, and it is going to have hyperlinks to take me to her problems and her allergies and her diagnostic results and her medications and so on. So I've now imported that clinical information into Prognosis. So by means of a compliance checklist with regards to Core Measure 14, the patient XML file can be exported or imported from Prognosis. That export file, if you're exporting during your test, needs to be encrypted for HIPAA purposes and then saved internally. And remember to provide that password to the recipient. Now the file is not being saved as an XML because when you assign that password and encrypt it, you'll recall when I did the file save as to my documents, it saved it with the patient's name and the date as a .exe. .exe is an executable that the system has compiled with that password. So the exe file is what you will actually be sending to the other party. They will then need that password so that they can extract the data and therefore have the XML, which is the data that will be used in their computerized electronic health record. And notice, please, that this is another measure similar to what we talked about on 13, where there's no way for engineering to go backwards in time and test this functionality for you. So if you forget to do this, when you get to the end of your reporting period, you'll actually be non-compliant. So it is something that you must be sure to do prior to 3 days before the end of the reporting period.